Good day, ladies and gentlemen, and welcome to COVID-19 media briefing call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session, and instructions will be given at that time. I would now like to turn the call over to Teddy Tushan. Sir, the floor is yours.
Good afternoon, members of the press, and thank you for joining the call today. As a reminder, we ask that all reporters please limit themselves to one question each to ensure we can get through as many questions as possible. If you do not get to your question on today's call, you are welcome to contact me afterwards via phone or email. Governor Tim Walz.
Thank you, Teddy. Good afternoon, Minnesota, and thank you for joining us again. We send out our condolences, and one more of our neighbors has become a fatality of COVID-19, and Commissioner Malcolm will go into a few more details. A good news story is that, as many of you may recall, 2 weeks ago, one of the state troopers who's on my detail tested positive and came down with COVID-19. He has since recovered and is fully back. So there's a good news story there. Before I talk about a few of the things that are happening and get an update, I just want to just reassure people, and I want to let Minnesotans know that the job that our journalists are doing on here has been nothing short of spectacular. The questions that they're asking are exactly the ones that need to be answered, and I think whether it's the names of congregate care facilities or trying to dig down deeper into some of the details is exactly what they should be asking. We are trying to balance personal privacy and civil liberties against public health in this time. Always with an understanding, though, in a time of crisis, and especially one unprecedented like this, misinformation or the lack of information is stressful and potentially dangerous. So starting tomorrow, I think I will walk through with folks a web portal, some dashboards that are able to, I think, provide more in context while still protecting individuals' personal privacies, but to make sure that as we're asking each and every one of you out there to sacrifice by staying home, by sacrifice economically, socially, to be able to track the progress that we're making around those ICU facilities, around the PPE we're getting, and how we're starting to think about the work groups and those chains of command that as we move forward towards peak, how are we going to make sure that we're inputting data and being nimble? And I'd like to do that. So I want to make sure that to acknowledge that fact, to make sure today that we will do our very best, as always, to provide as much as we can, but to know that these questions need to keep being asked, because as Minnesotans see this, I think there can be a sense of comfort in the work that's being done. At the same time, know that we are very serious about people's personal privacies and civil liberties. With that being said, I just wanted to reiterate a really great piece that came out of the COVID-19 supplemental budget. Yesterday, we announced that the application process for emergency grants was open. Those are being used now. Child care providers can apply. They're the ones that are providing child care for our essential emergency Tier 1 and Tier 2 responders. The grants are going to be critical for keeping that in the community, keeping folks working. Grants have about $10 million a month for each of about the next 3 months to keep the child care capacity up where we need it to. So I want to say thank you for that. And another issue, and you're going to hear from a new speaker today, Commerce Commissioner Steve Kelly and his team have been working with the Minnesota Health Insurance Plans. Several requests that we had around removing barriers to people receiving their coverage around COVID-19, and we wanted to make sure that coverage for testing, telemedicine, preventative care, and then should someone need treatment for COVID-19, to make sure that did not create an incredible burden on them. So Commissioner Kelly, working closely with them, was able to come to a conclusion. And today I'm happy to announce that the Minnesota Health Plans will be waiving cost sharing for treatment for COVID-19. What that means to Minnesotans on these commercial plans is it means that you're not going to have a bill when you go into, and should you happen to have to get care, they're going to waive that cost sharing. So you're not going to have to choose between rent and food around this. So I'm grateful to the health plans for working with us. I think it shows a real sense of spirit towards Minnesota, and I'm certainly grateful for the incredible work on many different fronts that Commissioner Steve Kelly and the Commerce Department is doing at this time. And so with that, I'd like to turn it over to Commissioner Kelly.
Commissioner Kelly, just want to make sure that you're not on mute right now.
Teddy, if he's not quite ready, I think we could jump on to Commissioner Malcolm to update on where we're at, and we can come back around.
Yep, that sounds good. Commissioner Malcolm?
Sure, happy to do that. Thank you, Governor. Good afternoon, everyone. We'll give you today's MDH update. Globally, as of this morning, we were fast approaching 1 million cases around the world and fast approaching 50,000 deaths. That's specifically 951,900 US global cases, 48,200 deaths. In the United States, we're now reporting 216,722 confirmed cases, over 100,000 of those in the New York and New Jersey region alone. In the U.S., we are reporting 5,137 deaths, 1,374 in New York City alone. In Minnesota, we now have 742 laboratory confirmed cases in Minnesota. It's an increase of 53 from yesterday. And as the governor mentioned,
9566. I was on a landline and I couldn't be heard in the conference.
I think we have Commissioner Kelly in the background.
Yes.
I'll just keep going.
Steve.
As the governor mentioned, we confirmed one additional death among our Minnesotans for now a total of 18. That was a 69-year-old Hennepin County resident, not associated with a long-term care facility. As of today, we have 373 patients who have recovered from COVID-19 and have been released from their isolation period. Since the start of the outbreak, 138 COVID-19 patients in Minnesota have been hospitalized. Today's total is 75 patients currently in the hospital. That is an increase of 21 from yesterday. 38 of those are in intensive care. That's an increase of 11 intensive care patients since yesterday. 37 in a non-ICU bed. That's an increase of 10. So I just want to repeat a couple of key messages for the day. I just want to repeat and stress again how important it is that we be focused on working with our long-term care facilities to protect vulnerable residents in those facilities from outbreaks. I want to say that there's been considerable discussion about, just in the last few days especially, about whether and how to share information about those specific facilities where we have had cases. And as the governor just mentioned, I think the media's questions about that have been entirely fair. We have been, since the beginning, recommending to facilities that have cases that they immediately inform residents, families, and employees. The health department has historically been quite cautious about sharing any sort of disease investigation information that could be used to identify individual patients or compromise patient privacy. This is just such an important value that we continue to hold dear in public health, because people working with our disease investigators are sharing sensitive personal information about their condition, and they need to have a measure of confidence that we will not use the information in any way that will expose them to unwanted attention or potential stigmatization. And that's also a stance that that is allowed within the discretion granted to the Commissioner of Health under state data practices laws to protect that information. That said, with the current level of concern and the risk associated with the COVID-19 pandemic, we believe it's important to balance that value with the equally legitimate value of government transparency and of sharing information with the public to help them understand the course of the outbreak and any protective actions that may be warranted. So to that end, we've decided to update our approach and to share more information about the outbreaks in long-term care facilities. We're still nailing down some of the operational details on this in terms of our notification process and timing, but we will be moving quickly in the next day or two to begin to make that added detail, including facility names of facilities above a certain size, public. I'd also like to reiterate a message that I mentioned yesterday about expansion of testing criteria. Our goal remains to expand that testing, but we know it still remains the case that we aren't able yet to test everyone that we would like to be able to test. While the state public health lab has some capacity constraints we've mentioned, that we're grateful for increasing private lab capacity, such as that offered by the Mayo Clinic, that adds to our statewide capacity. So as I mentioned yesterday, we really want our healthcare partners to continue to send samples for congregate care settings, that being long-term care, prisons, homeless shelters, to the state public health lab, and prioritizing these groups because we can manage a 24-hour turnaround time for those settings. We do encourage our healthcare providers to be testing their own hospitalized patients, to be making sure that samples are taken on everyone hospitalized, but also to test people in congregate care settings, healthcare workers, first responders, child care workers, and others that they think they need to test. So we continue to hear that some providers might be defining this more narrowly than had been intended, and that they may be restricting the definition of congregate living settings to nursing home residents only. So we want to just make sure that our healthcare partners know that we believe it's important to include other congregate living settings, such as homeless shelters and domestic violence shelters, in that definition, so that people in those settings get prioritized for testing, similar to the way we're prioritizing long-term care residents. And we want to make sure that workers in any of these congregate settings with that inclusive definition are getting prioritized, even if they would not otherwise be considered high priority due to their age or underlying health conditions. Finally, I want to just take a moment to publicly thank our disease investigators who have been working at an incredible pace for weeks and months now. In fact, well before we had our first COVID cases confirmed in Minnesota. Just want to share a little bit of data with you. Our staff at the Minnesota Department of Health has interviewed almost 700 healthcare workers that have been exposed to cases. If we include healthcare workers that facilities assess and report back to MDH, there have been over 1,000. Each one of those interviews represents a significant amount of work. They have contacted 1,631 people who are close contacts of confirmed cases who are at high or medium risk. These would be mostly household contacts and close workplace contacts, et cetera. Each one of these contacts get a personal call from our staff at MDH. This level of engagement in interaction is very, very work intensive. It's people intensive, but it's also very important to help us understand the risks and to help slow the spread within our state. So I just wanted to commend them for their excellence, their professionalism, and to thank them for their incredibly hard work. And with that, I believe I will pass it back to Commissioner Steve Kelly of the Department of Commerce, if he's on now.
Thank you, Commissioner, and thank you, Governor Walz, for the opportunity to talk about the announcement by Minnesota's health plans today. Over the past month, the Commerce and Health Departments have been working with Minnesota's health plans to be sure health coverage protects Minnesotans during this pandemic. In a March 13th letter to the health insurers, Health Commissioner Malcolm and I jointly outlined several areas where health plans could support the state's response to the COVID-19 crisis. We recognized in that letter that some of the plans were already taking some of the steps we requested. Since we sent the letter, Minnesota's health plans have taken additional actions in response to our request and the needs of Minnesotans. Today, the health plans are announcing that they are agreeing to take one of the most significant steps, eliminating cost sharing for COVID-19 hospitalizations at least through May 31st. The reason that this is important to Minnesotans is our goal that if you get sick with COVID-19, your focus should only be on getting better and recovering. You shouldn't have to worry about getting a bill that could ruin you financially, especially during this difficult time. So what does that mean for Minnesotans? Minnesotans in the fully insured and Medicare markets will have no cost sharing for COVID-19 testing. And then beyond that, Minnesotans in the fully insured market who are hospitalized will have no cost sharing for their in-network hospitalization. The plans are also encouraging Minnesotans to take advantage of expanded access to telemedicine services. This will help people to stay home and obtain access to care if they need it. Thanks very much for this opportunity.
Thank you, Commissioner Kelly. And now we'll go to Homeland Security and Emergency Management Director Joe Kelly.
Thank you, and good afternoon, everyone. Among the important work we're doing in the State Emergency Operations Center today is finalizing a letter from Governor Walz to the President requesting a major disaster declaration. To this point, we've been operating under a federal emergency declaration, which is different than a disaster. Without going into FEMA bureaucracy, under the emergency declaration, we're already eligible to get many of the costs of the coronavirus outbreak reimbursed by the federal government. And that's for stuff like running operations centers, activating the National Guard, as well as buying and delivering personal protective equipment, medical supplies, and any other measures or many other measures to protect public health and safety. But there's another important program we need a federal disaster declaration for, and it's known as Crisis Counseling Assistance. It provides funding to bolster existing community-based counseling services. Clearly, this incident is causing a great deal of stress and anxiety among Minnesotans. People fear for their health. They're worried about their job and how they're going to make ends meet. Relationships can get stressed by spending so much time together, and just the simple disruption to our regular routine is hard for us all. We need to meet that increased demand for counseling services, and the FEMA program authorized by a major disaster declaration does just that by providing 100% federal reimbursement for the additional services people really need now. I'll be sending the disaster declaration request paperwork up to the governor's office this afternoon, and I expect we'll hear back from the federal government very soon. Now to Commissioner Steve Grove with the Department of Employment and Economic Development. Commissioner.
Thank you, Director Kelly. Hello, everybody. We are here to give some updates first and foremost on the state's unemployment insurance program, which is seeing a record amount of attention and applications. We are up to 297,397 applications since March 16th. And yesterday we saw 24,640 UI applications come in just yesterday. You probably saw the jobs numbers nationwide. 6.6 million Americans have filed for unemployment benefits last week. We know that in Minnesota, we moved people pretty quickly into this system. The governor's executive order was one of the first in the nation that opened up unemployment insurance to those affected by COVID-19. And because of that, this week we're actually seeing less claims than we saw last week. We're one of only 4 states in the nation that has seen those claims numbers trend downward this week compared to last week, and we believe this is because we had that system open early and were able to process a lot of applications right away when the crisis hit. That said, we know that there's a lot of people who are experiencing frustration and challenges with trying to get unemployment insurance because it's a brand new system and program for over 85% of the people that are applying. This is a new program people are learning about on the fly as they move forward. And so we are doing a lot to help all of the applicants navigate their way through our system. And I wanted to just share for the public a little bit of what our team has been doing over the past few weeks to give you a sense for how we're responding and just to let you know we're working really hard for you around the clock. We have had thousands of hours of overtime by our staff. We have 50 additional staff taking phone calls. We've expanded the number of hours per week that we are usually open from 60 to 84. We've made a lot of new tweaks to our system to change the benefit request schedule and moderate that influx of applications, and to double the number of servers that we use to run the system so that it can run more effectively and more efficiently. We're increasing capacity for our phone lines, and we've posted a lot of great informational resources online at uimn.org. So we're going to continue to do more to make this system more robust and serve the needs of Minnesotans, and we really appreciate the feedback that we're getting from people. And we know that for so many this is a challenging thing to go through and a challenging process to walk through, and so our phone a friend guideline online is also useful, we hope, for people to help their friends and family navigate applying for unemployment insurance and getting those benefits as fast as possible. I can tell you that of all the weekly payment requests that have come in, we've already cleared 90% of them that are now set up for payment since March 16th. So we are moving quickly to process those payments at a very, very quick rate and are trying to get quicker every single day. Just to give you a sense for the kinds of applications we are seeing come in, once a week we like to give an update on just the industry breakdown. At this point, we see 66,355 applications in food preparation and serving, 27,871 in healthcare, including practitioners and support, 27,557 in sales and service, 21,881 in administration and support, and 17,166 in personal care and service. So those are the top 5 occupations that we're seeing applications come in through for unemployment insurance. We also know that many industries are hiring. This week, we saw more job openings on our Minnesota job bank than we saw last week. We're up to 3,821 new job postings in the state. Top 10 occupations, which again we're going to review weekly for folks. Number 1 is nursing assistants, 2 customer service representatives, 3 registered nurses, 4 medical and health service managers, 5 combined food prep and serving workers, including fast food. Much of this is for delivery. First line supervisors of office administrative support workers, social and human services assistants, personal care aides, computer system analysis, and software developers. So there are a lot of folks hiring, and we encourage everyone to go to mn.gov/deed to see more of those postings and the availability of jobs that are there for Minnesotans during this time. Last, just wanted to call out another set of businesses that's been doing great work up in Duluth. We've seen a number of restaurants and cocktail lounges come together, including Duluth Grill, OMC Smokehouse, Corktown Deli and Brews, and Noble Pour. All of them are closed down, of course, because of the pandemic, but they have come together to create a whole food bank and food service for the Lincoln Park neighborhood up there in Duluth to give gift cards and donations to the folks in that neighborhood to help them buy food during a difficult time. Just another great example of businesses coming together across our state to help each other, help their communities in time of need. With that, I'll turn it over to the Department of Education and Deputy Commissioner Heather Mueller. Heather.
Thank you, Commissioner Rove. Hello, everyone, and good afternoon. Every day you hear me share the message that the entire team at MDE, Commissioner Ricker and I, are really thankful for the work that our educators and our school staff are doing on behalf of our students and the work that they put into the creation of their distance learning plans. And today I just want to take a couple of minutes to really paint a picture for people about what that actually means. So in the 8 days leading up to distance learning, our districts and charter schools created over 500 individual equitable distance learning plans that work for their school communities while also planning for students who are receiving special education services, our English learners, our students who are experiencing housing instability, and those who are in foster care, just to name a few. So some questions we continue to ask are, what is distance learning? And a lot of perception is that distance learning is online learning. And that is not the case. Distance learning does not mean online learning. Educators don't simply upload their lessons onto an online learning platform and call it good. In some parts of our state and for some grade levels, online learning is not a good fit. There are many school districts and charter schools who are taking a more paper-pencil approach or a hybrid of paper-pencil and online learning. But regardless of the approach, districts and charter schools built a plan that was based on their school communities. Now, in addition to creating a model to deliver their lessons that strive to meet the needs of every student in their district, schools across the state also had to come up with their own system to help students receive services like nutrition and meals and school-age care. Now, when we think about meals for our students was one of the first components of their distance learning plan that was created. We know that for many families in our state, the meals that their students receive at school are the only ones that they're able to rely on. So once the Minnesota Department of Education was able to obtain the necessary waivers from the federal government, schools got right to work once again creating their individual methods to continue to deliver meals to families in need. And the turnaround for creating that plan was 2 days. And since that time, the Minnesota schools have served over 1.6 million meals to students since the buildings were closed to students on March 18th. Now, also as public servants, our educators know that it takes all of us to fight COVID-19 together, and that's why when the governor's executive order asked them to provide school-age care to our critical workers for free, they didn't blink and they sprang into action. Again, in just 2 days, over 500 school districts and charter schools came up with their own plan on how they were going to provide that care and how they were going to do so in a safe way that follows MDH guidelines. So I say it every day, and I say it here again today, that our educators are the heroes that are maintaining continuity for our students and families. What they were able to create in this short amount of time is nothing short of remarkable. You know, the right thing to do is not always the easy thing to do. And I would just like to, again, take this opportunity to thank our educators for doing what's right and not what's easy. And with that, I'd like to pass it back to the governor.
Thank you, Commissioners. We're grateful for that. We spent some time this morning on conference call with about 120 of our faith leaders talking about making sure we're administering to people's social, emotional, and spiritual needs and trying to figure out how the best way to do that. And then my team spent quite a bit of time working and in consultation with the legislature as they prepare to come back or to find some type of way to do legislative business on April 14th. We want to make sure as new issues have arisen that we're ready to address them. We know, and this team knows, we need to be nimble. We need to acknowledge when it's time to change course. We need to move smartly and we need to move quickly because this pandemic will not wait for us, nor does it care about our timelines. We simply need to keep as new data on the ground, as new experiences I'm on with other governors throughout the day, we're putting those in. So I want to thank our private sector partners, all of you who are getting calls at all hours of the night, thank you, and to the nonprofits who are providing that safety net. With that, let's open it up to questions.
Operator, we're ready for questions.
Ladies and gentlemen, if you have any questions at this time, please press star, then the number 1 on your touch-tone telephone. If your question has been answered or you wish to remove yourself from the queue, please press the pound key. Your first question comes from the line of Esme Murphy from WCCO-TV. Your line is open.
Thank you, Governor and Commissioners, for taking this question. Specifically, it has to do with what kind of information and when you will release the information about the long-term and nursing care facilities. I understand you to say that you are releasing it, and also if you could also go over the exact numbers for these facilities. How many cases have there been, and how many deaths have there been in these facilities?
Yeah, thank you, Esme. I'm going to turn that over to Jan, but I want to acknowledge that for all the listeners out there, the press is asking about this as we, both the commissioner and myself, described of trying to strike this proper balance. And Jan, I'll turn it over to you. I'm not quite sure you're ready to do that, but maybe you can give a timeline.
Sure. Thank you, Governor. Yes, Esme, it's our intention to put all the notification protocols in place today, and I expect that we'll be beginning to post the names of facilities that are above a size that would allow us to still protect individual resident and staff privacy. So that we'll be able to post the names of facilities with positive cases as long as those facilities have more than 10 beds. And our plan is to do that tomorrow if we can, no later than Saturday. In terms of, and that'll just be posted on the MDH website. In terms of the total numbers, we are now up to 47 congregate care facilities, which includes nursing, skilled nursing facilities, assisted living, memory care, and group homes in that congregate care definition. 47 facilities with at least one case. As I've said before, we consider even one case to be an outbreak, so to speak, and to trigger this enhanced level of assistance and monitoring by our staff in close coordination with the facilities. So of those 47 cases, 47 facilities, 36 facilities have one case, 5 of them have 2 cases, and there are 6 with more than 2 cases. The largest number of cases is 8 in one facility. And among those cases, there are 49 long-term care residents and 22 long-term care workers with exposures, with confirmed positives, I should say. 24 of the facilities have only resident cases, 17 of them have only healthcare worker cases, and so it's 6 facilities that have a mix of both resident and healthcare worker confirmed cases. So that is what I can share with you. I know that Chris Erzman's also on the line as a resource. Hopefully that answers your question, Esme.
If you can also tell me how many deaths there have been in those facilities, and how many deaths there have been in those facilities, and also how many are you including prisons and jails in that count of congregant facilities?
On the last question first, no, the jails and prisons would be counted in their own category, as will homeless shelters and any other kind of group settings like that. In terms of deaths associated with long-term care, I'm going to ask Chris to indicate that, just so I don't misremember it.
Yep. We've had 11 residents who have passed away from congregate care settings, so that's 11 of the 18 deaths that we've seen in Minnesota.
Thank you so much.
Your next question comes from the line of Matt Sefik from Minnesota Public Radio. Your line is open, sir.
Hi there. I have a question about this agreement with the commercial health plans. And if somebody comes down with COVID, they have to be hospitalized. Given the pressure that we're expecting on hospitals, what happens if somebody winds up in a hospital that's out of their network? Will they still have to pay any cost sharing? And I guess the second part of that question is, what were negotiations like with the health plan? Why did it take them nearly 3 weeks to come up with this agreement?
Steve, Commissioner Kelly, I'm going to defer to you for the expertise.
I'll answer the last part of that first, Matt. I think the plans have been assessing the risks of this pandemic all the way along, and I think it took them a while to arrive at the point where they felt comfortable from a financial point of view, recognizing that they could waive the cost sharing for in-network hospitalization. Now, we do recognize that, especially if the situation were to get worse, that some Minnesotans might need to be taken care of in hospitals that are out of network. The plans have not made a commitment on that, but the Department of Health and the Commerce Department intend to continue to work with the plans to make sure that if we do get into a situation where more Minnesotans may be taken care of in out-of-network hospitals, that the plans are recognizing that that's not a choice by Minnesotans, that that's a necessity arising from the pandemic, and we'd continue to work with them to make sure that even in that situation, people are covered. But the plans have not made a commitment on that at this stage of the game.
Okay, thank you, Commissioner.
Your next question comes from the line of Dave Arick from Pioneer Press. Your line is open, sir.
Thank you. I have a question in two parts. They both relate to the status of the hospitals. At the Senate's task force meeting a short while ago, Mary Krinke from the Hospital Association gave an assessment of the hospitals. And in essence, they're hemorrhaging money and they're worried about staffing needs. The two questions are this. The first one is to Governor Walz, and that is, she said that they want licensing requirements waived so out-of-state nurses and assistants can come in and work in our hospitals. You were asked about this yesterday. You said you hadn't heard about it. So now they've said it. What are you going to do about that?
Yeah, I'll take that first, Dave. Thank you. And I did hear about it yesterday afternoon after we got off the call. I got on with the Rural Hospital Associations. What it looked like there was along the bordering states. It was a call that came in from Breckenridge that asked about that. My team is assessing that. We're certainly, if this is a solution that they need, we will certainly look at it, try and honor that. You didn't ask about it, but I do think it's important for folks to know, especially all hospitals, but rural hospitals especially, they lived on a very thin margin as it was, and this is catastrophic in terms of their finances. So I think while they're putting all their effort into building for the surge of caring for their folks who are there, the administrators and our administration are quite honestly looking to what the future looks like, because there's the potential, like many of the private businesses, that some of these rural hospitals may not be able to come back afterwards. So they're absolutely right. We hear them on this. We will explore this licensing issue, whatever it takes to make sure we have the right staff in those hospitals at the right time.
Thank you. And the second part of the question is for the health commissioner. The $50 million approved by the legislature for hospitals, Mary Krinke said that none of that has gone out yet. That's the $50 million as part of the larger $200 million that's for grants. When will that money be going out to hospitals?
Sure. We just of interest, we got over 1,200 applications requesting more than $256 million in that first $50 million grant fund. So as you can see, the requests far outstrip that source of money. We are going through those right now. It certainly is our goal to get them out quickly. That was the whole point of the legislation. We're also trying to make sure that we understand what source of funds is most important for what types of, or most suited, most appropriate for which types of expenditures, given that there were several different parts of the legislature's appropriations aimed at helping public health and health care, as well as what we understand to be coming from the federal government and what we understand to be reimbursable currently from the Federal Emergency Management Association. So we're just doing a lot of work to make sure that we line up the most appropriate source of funding. But we have been through all of those grant applications. We're trying to prioritize them now and anticipate that will be forthcoming just in, I would believe, early next week.
Thank you.
Your next question comes from the line of Emily Havoc from Care 11. Your line is open, ma'am.
Hi, Governor, Commissioners. Thanks for doing these calls and thanks for your work. Governor, I think this one would be for you. Can you talk a little bit about how they're implementing social distancing at the DOC facilities? We've heard concerns from inmates at Stillwater that large groups of 200 plus people are still eating together. And then I guess what screening is happening with the staff who come into these facilities or with other inmates being transferred in?
Yeah, thank you, Emily. This is another one of those that keeps me up at night, and I think potentially tomorrow. I've been trying this week if it would work out, but we've not been able to get Commissioner Snell on. I want to get him on to talk about this. They're doing the best they can, but these are just across the country really difficult. I think you saw today the Rikers Island situation seems to be melting down. We're doing all we can. One of the things is especially we stopped some of the programming of the different classes, but that has its own problem. Locking people in a small cell 24 hours a day doesn't work either in these settings. So they're doing the best they can. There's alternate plans coming up to how do we separate, how do they, especially around those congregate settings of lunch and those things. So I would rather hold and get Commissioner Snell in front of all of you to maybe ask about this. But I think for your listeners out there, this is a tough situation. We have are making moves and taking suggestions around when we have people close. They're in a few, 30 or 60 days of their release time anyway. They're already being processed out by this time. They've got a place to go to. We're going to take some action to try and accelerate some of that to relieve some of this crowding, always taking in, community and public safety first. But the situation is challenging. We have a responsibility to the workers that are there, the corrections officers, and a responsibility to provide humane treatment for those that are incarcerated. So I'd like to get him on here, give you a little bit more, acknowledge that we've been working hard on this, but it is a unique challenge because we can't just social distance inside that set given space, especially in these older facilities. So we'll follow up with you.
Thanks, Governor.
Your next question comes from the line of Tim Nelson from Minnesota Public. Your line is open, sir.
Hi, Governor. We're getting a lot of questions from people about going golfing, boating, fishing, et cetera, and if they're allowed to travel to do these things. There seems to be this tension between things like outdoor activities, which are explicitly allowed in the stay-at-home order, and the call to limit non-essential travel and stay home as much as possible, and of course, not be a burden on small towns' healthcare and staples. What's your guidance for people who are trying to navigate this?
Yeah, well, we need to do more work, too, that this is an ever-evolving situation. I want to acknowledge folks about that. I know there's folks up north that are the friendliest people you'll find, but they're telling us to stay home if we're down here for reasons that do make sense. Because of the capacity we're seeing down like in Fairmont, when you get a small town that gets overrun, that healthcare system overruns the same way. What I can tell people, and again, the logic behind these, I'm thinking about it, you're out on a boat with just your family, you dock it by yourself, you're away from everybody. I also want to acknowledge the issue around golf. I have got to keep people functioning the best they can and stay sane. I know that if fishing is your thing, it's your passion. If golf is your passion, if running is your passion, what I would just say to people is please know that we're still trying to evolve these. I make these decisions based on the best health guidance that's given to me, but also measuring those against the sustainability of a stay-at-home order that puts a lot of pressure on people. So what I can tell you on this, Tim, is we're trying to clarify. There's never going to be a pure, black and white. We follow the CISA guidance from Homeland Security on businesses, but we've got to adapt. So for all those folks, especially those with golf, we're taking this very seriously. I'm trying to figure this out. If this is going to last a while and two of you can go out and not be beside each other, we maybe need to figure that out. I'm asking my folks to do that. And as far as the travel, we're going to have to, and again, I don't want to get into place, and I bring this up yesterday when the issue came up about the tip line. That tip line's to keep us safe, and one of the reasons we put that thing in place is we were getting a ton of calls to the 911 system just reporting large gatherings. That 911 system has to be reserved for other emergencies. So what I would tell you is this is an ongoing conversation. As this goes forward, we will continue to refine and clarify. And for the folks who are asking this, these are not frivolous or things that are back burner issues. They need to be simultaneously attacked, and we're doing that. So I hope to be able to give some more information because especially as it's getting spring, we need to clarify these in a way that I think makes sense to folks, but also folks can abide by them because I don't want to put anybody in a situation where they feel like they can't go do something healthy with their family and not expose others. So we'll keep working it.
Thank you.
Your next question comes from the line of Bill Werner from Minnesota News Network. Your line is open, sir.
Thank you. Hello, Governor. This is probably one for Commissioner Malcolm, or perhaps you'd like to tackle it. Again, Ms. Krinke, talking in the Senate Working Group, said that hospitals really need some health department guidelines on the use of personal protective equipment so they can control the burn rate. And also they need more information from the state health department on what is the stockpile of personal protective equipment, again, for the same reason. Appreciate if you'd address that.
Yeah, I'll start it and then let Jan do that. That's what I'm going to be doing, Bill, tomorrow. And it's one of the things is that we can't get that answer on the Strategic National Stockpile. We have spent these last 5 days since we ordered the stay-at-home order getting all of those things in place. And what I hope you'll see tomorrow is a dashboard that starts to show that so everybody in Minnesota can start to get an idea. One of the things I would say, this standardized guidance, in times where we're not in crisis, each of the health system kinds of wants us to stay off their back and allow them to put in their protocols for their nurses and their staff. And in each one does it a little different. This is the same issue that I would call it pleading and a cry for help from the nurses that also want some clarification on this. And it's easier said than done, but we hear where they're coming from. The thing I can tell you, like every other governor in the country, the PPE, and we'll have a chart that'll show you the burn rates. We know now how many days of gloves we have, how many days of masks we have, how many days of other things we have. We'll start putting those out there. But they are not nearly as robust as they need to be. So one of this is we'll get good information out, but people need to know how to interpret that data so that we don't panic people, and so we know that people don't start hoarding this, and we start moving it correctly. So, Jan, if you wanted to add anything to that, go right ahead.
Yeah, thank you, Governor. I think you actually made the key points very well. Yes, we certainly understand. We are hearing from the providers that more specific guidance would be helpful to them. There is a lot of guidance on the CDC website and the health department website, but there are lots of shades of gray in between, and how you implement that guidance in an ideal situation versus in a shortage situation is where I think the systems would like more specificity from us, and we're working to try to understand what are their most pressing questions and what's the best advice we can give them. But it is just that. It's here are some best practices on conservation of PPE on the highest risk situations. But just the unfortunate reality is with the shortage of equipment globally, there is, just to be honest, there is often going to be a gap between the ideal recommendation and what's possible. And we're just working as closely with the providers as we can to give them the best support and the best guidance, but it is still going to come down to kind of a judgment of the frontline folks in their own situation.
Commissioner, just so that I'm clear, but did I understand the governor to say that tomorrow there's going to be some information available to providers statewide about what kind of stockpiles, how many masks, how many gloves we have, those kinds of things? Did I understand him correctly?
Yes, Bill, correct. That the governor's talking about a public-facing dashboard that will help everyone be able to see some of these key metrics. But in terms of what we are sharing with the health systems, that is flowing between the structures that we've talked about on prior calls. There are regional healthcare coalitions and a statewide healthcare coordinating center that are collecting data from the hospitals and from long-term care, and increasingly now being able to feed back to them clarity on what's available. But so much of this effort heretofore has been just figuring out what is where and who's got what. So now we think we're getting a pretty good handle on that.
Thank you, Commissioner. Thank you, Governor.
Yeah, and this has been the challenge, Bill, across the country. And I think, we've seen in the last 24 hours, the federal government's put out conflicting information about the use of masks. And this extends to home health providers. It extends to our first responders. And I think in this time, as the commissioner so clearly put, it's just hard to have the black and white. And it sometimes becomes that judgment call. But we hear them, and we'll try to continue to push that information to everyone in the state.
Governor,
Thank you.
I must follow up on this. What are your thoughts on should every Minnesotan be wearing a mask of some type when they're out in public?
I'm waiting to hear the advice from everyone else, and I hear the advance is no, but there's still information out there, and I have to be very, very careful not to put out. I listen and read everything. I look at CDC direction. I listen to Commissioner Malcolm and Chris Ayresman, but at this point in time, I don't think there's a definitive answer on that. And to be very honest, we need especially those N95 masks for those that are most at risk as the providers.
Thank you, sir.
Members of the press, please limit your question, one question per person, please, so we can get through as many reporters as possible.
Your next question comes from the line of Theo Keith from Fox 9. Your line is open.
Hi, Governor and Commissioner Malcolm. Right when you started this phone call, I was watching the Senate working group, and Mary Turner from the Nurses Association was literally in tears as she was describing to senators the problems that nurses are feeling in hospitals. One being that they're getting laid off from certain job functions that are not coronavirus related. A second one is they're having to wear the same mask all day long when ordinarily they would be discarding it more quickly, feeling that they're being put at risk because of the lack of PPE available. What do you tell them?
Well, I spent an hour with the nurses and with Mary, who is a passionate, a frontline nurse herself, a passionate advocate for other nurses, and they're absolutely right. This is a situation with the lack of personal protective equipment that has put nurses and frontline workers across the country at risk. Our commitment to them is to do everything within our power, using both the supply chain ability we have, using private sector. I spoke with a local CEO of a medical company last evening who found 100,000 masks and delivered them over. We found 80-some ventilators by making these calls, and I just keep telling them we're buying this time to try and get there. But I think people do need to recognize the shortage of personal protective equipment is a serious thing. It's why we're doing all we can to get the manufacturing up, and I think it's important to note, as Director Kelly said yesterday, someone sent me a homemade Minnesota Gopher mask, and it's wonderful. That won't work in the setting. That may work if I'm walking on the street, and so I don't cough on someone else, and that is a wonderful gesture. But we have got to do better. We have got to ramp up production. I and the governors across the country continue to ask. We need a focus like we built tanks in World War II to build these things, and they need to be done now. So I tell we're doing all we can with them. They are truly on the front line and putting themselves and their families at risk. We, the rest of us, and those that are in a position to make these products move, need to get it done as quickly as possible.
Your next question comes from the line of Tom Hauser from KSTP-TV. Your line is open, sir.
Hello, Governor. I have a question about school closings. I know they're closed until May 4th. Some governors have already called off school for the rest of the year. I'm wondering what you think the likelihood of that is in Minnesota, and also for Heather Mueller on the same lines. Are you giving any guidance, or if school districts look for guidance from you or the health department about how to conduct graduation ceremonies safely?
Yeah, I'll defer to Heather here in just a moment. And I just think in all candidness, Tom, as this is evolving and, the virus and the care and the health officials drive the timeline on this, I think it's a relatively strong possibility that will happen here too. And I think we're trying to convey to people that they are going through their distant learning. Our students are doing what they need to do, but I think the chance of being able to gather back at school is relatively slim. And then I would defer to Deputy Commissioner Mueller on some of these things like graduation and prom. And this is heartbreaking. We have a whole generation who's missing out. We would have seen state track records fall. We would have seen perfect baseball and softball seasons. We're not going to. So, Deputy Commissioner.
Thank you very much, Governor. And it's true; those are very hard things to lose as a student. But it's also the real understanding that the decisions are being made in the best interest of the safety and well-being of our students and families. When you talk about graduation, we are going to be looking at. We have all remained hopeful that we would be able to go back, and hope, although it's not a strategy, it is something that continues to keep people going. We are going to be looking at what type of guidance and recommendations we can make. And going back to our school communities, know their communities best, and they know their students best. And they will all be figuring out really creative ways to ensure that they will be able to honor the students that they have that are graduating in the year of 2020. And we'll support them in that. And so we are looking at if that decision is going to be made or would be made, how it is that we can do some of those things, whether it's done online, whether students are standing outside on their driveway and people in the neighborhood can come out and clap and celebrate, and there is a statewide celebration. There are all kinds of things that we can be thoughtful about, but we also know that our schools and our school districts have been giving a lot of thought to this, and they know their school communities, and we're going to engage with them in those conversations when our time comes.
All right, thank you both for that. I have a daughter who's graduating this year, and she was curious.
Yeah, and
I understand that.
I think we've talked a lot about this, and I have to tell you, whoever thought it would be funny on April Fool's Day to say that I put out an executive order sending people back to their last grade, that was not well received in my home, and I'm sure others across the state. So,
no.
Stay focused, people.
Yeah, that's right.
Your next question comes from the line of Jeremy Olson from Star Tribune. Your line is open.
Hi, yes. Governor, a few different times you have said you've taken a look at available data and suggested that the social distancing so far is making a difference. I was just wondering if you could elaborate what your latest review of the situation is and how you know what specific data points you've received so far that make you say that.
Yeah, and we're starting to see in places that are a little further ahead of us. Obviously, the Bay Area in California has some pretty good data, and they took some, pretty aggressive steps early on. I'm asking my team through some of the travel data, through some of the metro transit data, and those types of things, and then match that up population-wise because there's some data out there on the 50 states. Infection rates, and again, I think you have to be very careful about that, as Commissioner Malcolm always warns us. The small number of tests overall to the population may be a bit of a problem, but the number of people that we're seeing in hospitals and the number of discharged seems to indicate that we are having an effect on that. And I say we probably nationally, and here we're trying to refine that a little more. So I just think it's really important for everybody, and I'm one that have to keep reminding everyone and myself about this ever-evolving data. We are adding new Minnesota data. We now have a broader spectrum of that to rerun some of our numbers, and I'm telling everyone around us, we need to be prepared if the data goes in a different direction for us to go in a different direction. But at this point in time, everything we're seeing and everything we're hearing, and as you're watching, even reluctant states are now starting to see that social distancing is probably the only way to buy time. But as we start to refine that and get more data out, we'll get it to you. But at this point in time, it's not as hard as we would like it to be, but I think there's enough there that I certainly am comfortable with the decisions that we're making around social distancing are the right decision.
Thank you.
Your next question comes from the line of Joe Nelson from Bring Me the News. Your line is open.
Yeah, thank you. Say, Commissioner Malcolm, based on what you've learned from the cases here in Minnesota, are there any underlying conditions that are showing up as more prevalent in patients who have not survived the disease, or with patients who have required critical care in ICU or with a ventilator?
I'm going to ask Chris if she's still on the line to chime in here. But one of the things that we've talked about before is how important collaboration with our health systems and with our research community is. And I know that there are some clinical researchers interested in working closely with us to dive into exactly those questions on what more we can understand about the way that COVID affects people with very specific underlying conditions. And I'm really looking forward to seeing some of that work and getting that into the hands of our practicing providers to help them best manage these cases as they come forward. But Chris, can you add to any patterns that we're seeing? And she may have had to drop off the call and gone to something else. So if Chris is not on the line, we'll just note that question and maybe come back to it in a future call.
Appreciate it. Thank you.
Your next question comes from the line of Steve Karnowski from Associated Press. Your line is open, sir.
Yeah, hi, Governor. Earlier today, Senator Gazelka was tweeting about the problem with workers' comp and covering the frontline workers. He made it sound like the sides are getting close to an agreement here. Is that your take on it, or where do you see that as being at? Will an agreement get done?
Yeah, it'll get done one way or another. We have to get these folks covered. I don't know, and I wasn't in on the legislative discussions this morning. Some of my team were, and they preliminary reported back there were still a few ifs. But these are folks that are both our firefighters, our police officers, our EMT, and our home health care workers, folks that are truly on the front line, and getting them involved in should they not be able to go to work. And so I hope we're close. One way or another, we need to get that done. So I'm glad the Senate is taking this up. I wish we had finished it last week, but one way or another, we will get those folks covered.
Your next question comes from the line of Mariela Hammer from PBS. Your line is open, ma'am.
Governor, I'm going to be talking with Mayo Clinic here in just a moment and wondering about their test coming out for immunity and what's the state role in subsidizing, distributing, deciding who gets this first, and then who can return out into the world if they are immune.
Yeah, and that might be a good question for Jan. Please tell them thank you. Also, thank you for their benefactors down there. I believe they got some help to be able to test our indigenous folks at no cost. So we are blessed to have Mayo in the health systems we have. I've talked about this, and I watched Dr. Birx yesterday somewhat downplay this and said the administration is not focused on the antibody test. I think that's a mistake. I think Mayo thinks that's a mistake. We will work then. Should this be a process that works, I think we are very interested. Jan, Commissioner Malcolm obviously has a lot more expertise in how we would implement that and how we would roll that out. But I'm just excited of where they're at and what they're moving. So, Commissioner, I don't know if you'd want to add anything to that, but should that become a possibility to have a dependable and verified antibody test, I think we would be very interested in partnering.
Yeah, absolutely, Governor. And we're in close contact with Mayo as to where they are in the process of the test being available and being verified. They're very careful to make sure that they know for sure what the serology is telling them about how much shedding of virus happens at what stage in the infection and when immunity can safely be predicted. So it's very promising. More of the verification work to be done, I think, before that becomes widely available. But it's, as the governor has said, we are. It's just an enormous asset for the state that we have Mayo's kind of cutting edge R&D capacity here in Minnesota, and we absolutely will be intending to put that to use as soon as we can.
Operator, we have time for one more question today.
All right, your last question comes from the line of Oscar Rodriguez from Univision, Minnesota. Your line is open, sir.
Yes, good afternoon. I was wondering, are there any information as far as how many Hispanics are being tested as far as the overall completed tests? I go here routinely daily on the Department of Health website, and there are no metrics as far as the Hispanic community is concerned.
Thank you, Oscar. Commissioner, do we have a breakdown?
Governor, yes, we do in terms of, as we keep on saying, the number of laboratory confirmed cases that we have. And this is all self-reported data, and a certain percentage of the population declines to answer that question. But as far as we know, it's about 5%, a little under 5% of the total positive cases who are in the Hispanic population.
Okay. The question is being asked when they are doing the testing.
Yes, correct.
Okay. Thank you.
Governor,
well,
your final thought before we wrap.
Yeah. And Oscar, I would follow up on your thoughts. I was on this morning with our Asian and Pacific Islander community leaders about making sure that we're doing the best we can to get information out to all of our folks in Minnesota, making sure that language barriers and things are brought down, and making sure communities feel comfortable in what we're doing. So I thank you for asking the question. Once again, everyone, I want to give a thank you for the continued ability to get out good information to folks. I want to make sure, and tomorrow, that we'll change this format up a little bit. I think as all this work is being done, there is a simultaneous need for us to be communicating as clearly and as transparently as possible with Minnesotans so they're getting the best information and seeing how things are evolving. And then once again, just the small acts of kindness to one another. To thank you, my friend Amy down in Rochester, for the Golden Gopher mask. It's wonderful. And I saw another story, and this one comes from up in Hibbing. our Iron Range communities are strong and they're close. And the manager of the Hibbing Lowe's store up there, Curtis Larson, opened up his store to give free supplies, bleach towels, spray bottles, and buckets to all first responders on the Iron Range. Just that type of caring for your neighbors, that type of in an economic, just awful situation. Curtis, thank you on behalf of Minnesotans. Thank you for making all of us proud, and thank you for caring for folks. Everyone will be back again with you tomorrow. Thank you.
Find more local news stories at ccxmedia.org and follow us on social media.